My wife, Magali, she started having trouble breathing. She would kind of feel winded, and had some bad body aches, headaches, stuff like that. It was the 12th of March on a Friday. She just wasn't having it. It was just she was feeling real bad, and so I told her, I said, I gotta call the doctor, and she told us come to Medical City Arlington, get on over there to the ER. They need to check her out. And I said, just please do your best to save both of them, because my wife is everything to me, Those couple hours there were the darkest of my life.
After the C-section, her child went to the NICU to be treated there in the NICU, and we took over care of Ms. Sanchez in the ICUs. Anytime we have a patient come from Women's Services, it's a collaborative effort between the nurses over there and the ICU nurses. So we kind of combine all our expertise so that we can give the patient the most optimal care. But throughout the course of her treatment, she slowly started to turn around. And eventually got to the point where she was able to discharge to a rehab facility where she could get her strength back. But I can remember the day they brought the baby over from NICU, and the first time she saw the baby, it was really emotional for everyone. Everybody was really nice, and always detailed updates, on my son and my wife, and that means the world to me, because being at home and not knowing what's going on with your wife, with your son, having to take care of a baby at home and recovering from COVID myself and everything, it was horrible. It was a nightmare.
I think that sometimes we have to look at the whole family as a whole, and sometimes just not the NICU, the mother, the father, but in this case, the mom was separated and the dad was left here with the baby. We, as a team, collaborate with that other ICU to help the entire family just bond and understand everything that's going on. I felt that maybe we could help in some way alleviating that stress. So I got the team to have a little baby shower in NICU, and everybody was in for it. So we made a list of things that he actually needed for this baby, and that hopefully would help him and feel better.
These nurses, the people here at the hospital, they didn't need to do that, but they wanted to. And it just shows the quality of people that work here, and how much they care. That's the key. Is, to me, I feel that when you come here, you're coming here and you're gonna get the best treatment from people that actually care, and that makes a world of difference.
Actually, hearing the words from a father telling us that he really is appreciative of our care, we know we did something good for that family and for the baby and for the mother as well. I know that because of the work they did and the care they gave her, that she was able to be reunited with that child.
There's no place other than this hospital that I would have my family being taken care of. Yeah.